Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Brumell.
Good afternoon, and thank you for joining us for American Medicine Today. I'm Kimberly Brumell, joined by world-renowned orthopedic surgeon, Dr. Alfred Bonati. As well, we have AM Tampa Bay's executive producer, Aaron Jacobson, with us.
Thank you. How you doing?
Very good. And our favorite senior fellow, Jeff Wagstaff. Thank you for being here.
Good afternoon. Happy Saturday.
Well, you know, every week we talk about why people should pay attention to Dr. Bonati. And well, that's because he really paved the way for all of minimally invasive laser spine surgeries on the market. But most importantly, his contribution to medicine, which are the Bonati spine procedures. Before him, there was only traditional open back surgery. And what that meant for people is not good recovery times, long recovery times, hardware, a lot of problems that happened to people. Well, he saw that and he really took it to heart because he wanted to do right by the patient. And he developed his own tools and instrumentation to make that possible. And with the Bonati spine procedures, he is able to quickly get to the root of the problem and remedy the patient's true pain. And we have such a high success rate. Now, I know our commercial says over 94%. Well, a recent 7.5-year survey reflects over 98% patient-reported satisfaction. That is huge, especially when you consider with traditional open back surgeries, if you have a one-level fusion, you're at over a 60% failure rate. And if you have 2 or 3, you're anywhere from the high 80s into the 90s for failure. So when you have an alternative on the market that is 94 plus and closer to 98%, well, I think that speaks for itself.
You can't argue with those numbers. You really can't.
No, you can't. So with that said, we have a very full show today. We have guest Dr. Randall Latour, a top Tampa otolaryngologist, and I think I got that out right. So they're going to be joining us later this show. But first, we have in our Back to Life segment.
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
And with that said, I would like to welcome to the program Paul Wagner. Now, he is on the line from Clarksville, Georgia. Thank you for being here, Paul.
Yeah, you're welcome.
Why don't you tell us kind of how everything transpired for you? What was the cause of your pain, and for how long were you suffering?
Yes, that's a great question. I'm 56 years old, and in my teens, I raced motocross very competitively, and I had a very bad motocross accident and immediately had to go to the hospital and had a discectomy in L5, and I was in the hospital for 28 days. My recovery was tough, but then after about 8 to 10 years, I got bone on bone on L5, and the pain just became really bad. And I've had chronic back pain for 30 years. And when I'm in travel and sales, I've been in travel and sales for 35 years. And boy, does it affects your whole life, not only your everyday life, with simple things like brushing your teeth, making your bed, reaching for anything. More importantly, it affects your job performance. It affects your relationships. I'm an athlete. It affects any type of sports like working out, playing golf, snow skiing, which I love to do. After a round of golf, I would be in agony for that evening and most of the next day. And also in front of, again, relationships, your customers, being in outside sales, it affects your everyday life. And the traditional, I saw a lot of orthopedic surgeons that do the traditional fusing type situation. As I went on and I was on L5, my L4 basically got black and dried out.
Paul, you told us that you were experiencing a lot of pain and discomfort about 10 minutes or 10 years after this original accident.
Yes.
Tell us what you did to try to find relief there locally where you live.
Well, I mean, it's that's a very difficult situation. I would see a chiropractor. I, would wear a back brace. I have a jacuzzi, massage chair. I would do anything at my disposal to try to feel better. But at the end of the day, you still got that pain. And it's a pain that affects everything you do, your everyday life, your relationships, your work. It comes into play everywhere. And it's after that 10 years, I've had chronic back pain for close to 30 years.
Let me ask you a question, though, Paul. With that pain, was it a radiating pain? What type of pain was it?
Yeah, that's a very good question. It was in my lower back. It was L4, L5, but it was just in my lower back. It did not go down my legs, so I was very fortunate there. But still, I was bone on L5, and my L4 was diseased and dried out.
Right.
And you can imagine the pain that I was going through in that area. Also, as that got worse, I have degeneration in my neck area, and the pain was definitely shooting down my right arm quite badly. Very uncomfortable.
What led you to the Bonati Institute? Tell us how you found out about the Bonati Institute.
I'm a traveling salesman, and I in the last 12 years, I've been in dentistry. And two of my dentists, one especially, Dr. Larry Tilley, he could see that I was, in pain when I came in and called on him. And we started talking. We struck up a conversation about back pain, and he had just gotten back from the Bonati Center, and he just couldn't tell me enough great things about the Institute. And he gave me a wonderful brochure that they've got. And this is exactly the option that I've been looking for the last 20 years, because I have gone to your traditional ortho doctors, and they want to do double fusion in my lower back and then fusion in my neck. And I have seen so many people I've seen that do not do well with that. The recovery time can be 6 months to a year, and it in a lot of cases the pain is not taken away.
What convinced you that the Bonati treatment was different from anything else you had seen in the past?
Well, yes. I mean, the brochure does such a detailed job of going through their procedure, and it's a unique procedure. You're outpatient. You walk out of surgery 2 hours after you have the surgery, and to me and the pain is alleviated. It's Dr. Bonati takes care of the pain, and that's what affects your everyday life is the pain. It's no quality of life. But that is what separates him is his procedures, his arthroscopic instrument, the fact that you're awake during the surgery, watching it on TV, the fact that you walk out of that center 2 hours after your surgery, and I walked around my hotel about 15 to 20 times that evening. So that is why. I mean, it's an amazing process.
I had a question for you, because you talk about being a motocross racer and very sports oriented. When you found yourself limited, how did that make you feel? Did you become depressed?
Yeah, that's a great statement. It affects everything about your life, and yes, depression does come in. But the main thing is trying to deal with the pain and not being able to do the things you love to do. I wasn't able to play golf for the last 2 years. Golf is very important in my business, my personal life. I love to snow ski. I love to go to the lake. I love to work out. All of this is affected by that.
Now, I'm a huge golfer, so what I want to know is, how long after the surgery were you able to play golf?
Well, now here's something I just had surgery 4 weeks ago, so I'm swinging a club, but I haven't been on the course yet. I'm still, doing my exercises, walking, stretching. I'm very close.
Anyone who's played golf knows that 4 weeks after surgery, if you're able to swing a golf club, that is something, because everything is in your back.
Absolutely, and the biggest thing is I can tell you right now, I am pain-free for the first time in 30 years. And it's the most unbelievable feeling you'll ever have when you've been in the type of chronic pain that I've had.
Wow. Let me ask you something. You talk about being in that sort of pain. You were referred to the Bonati Spine Institute by Dr. Tilley, I believe you said. And what was that experience like when you came in? Because I know people are a little bit apprehensive, even if they've heard great things, because that fear factor, the fear of the unknown, what to expect. And then what was the evaluation process like? Did you have diagnostics? Did you feel like you were properly assessed when you were there?
I am so glad you asked me that question. Yes, you are nervous when you come in. You are apprehensive because this is a different type of procedure. But as soon as you walk in the door, by the way, the facility is beautiful. But when you walk in the door, you're greeted by Paul, and that's my name, Paul, so we hit it off. But everything, the fear is taken away pretty much immediately. Mm-hmm. You go to Paul, he tells you about everything, and then you go get your MRIs done. And, on that note, the traditional MRIs, I went to Emory and had MRIs done. They basically just give you two photos, a picture of your lower spine and a picture of your neck. Well, Dr. Bonati, he goes through level by level and explains everything to you and shows you. It was the best consult I've ever had from any doctor ever. And he takes the time to go through every level in your neck and your lower back and shows you pictures from the top, the side, the bottom. And that's the consult. And Ken, the RN, is there to be with you through this process. And I did skip a step. You first go to Kathy, who's
Paul, hang on for just a
lady.
second.
Yes.
I want to get you to hold on just a second.
Yes.
We're up against a hard break. Kimberly, tell folks how they can get a hold of the Bonati Institute if they're experiencing pain.
Well, they can reach out to 855-267-0482 or visit Bonati.com. Coming up after the break, we will hear more from patient Paul Wagner about the Bonati spine procedures. You're listening to American Medicine Today on News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
The Bonati Spine Institute is proud to announce more than a 94% patient-reported success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit us at Bonati.com.
All my pain is gone. Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful.
I feel fantastic. It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.